everyone, welcome to Sonographers in the Cities. I'm Lynn.
And I'm Giselle.
I hope you had a good week last week. We are in second week of July and hope you're having a good summer so far. Thank you so much for tuning in. Thank you so much for watching. Before I forget, please set your notifications on Apple, Spotify, any platform you're listening, and subscribe to Giselle's channel.
Yes.
For more content. And please don't forget to rate us on Spotify and Apple. We greatly appreciate it. Thank you.
Yes, thank you guys for everything. It is a new week. It's a new month. We're in July, halfway through the year. Can't believe it, but we're here. And we're going to be diving deep into different types of scans and studies that we do in ultrasound. We did have an episode in the very beginning of our podcast, episode number 2, where we talk about types of what can sonographer scan, basically. And if you listen to that podcast, it was before we had our microphone situation, and it was before we had our kind of groove almost. Today, we're going to kind of do an updated version of that. Talk about the different types of scans we do, because a lot of times when you go into ultrasound, you think you're just going to scan babies, and we're definitely not just scanning babies. Lynn doesn't even scan babies at all right now, but you're learning, right?
Yes, I'm learning to scan babies.
So think about that. People who are going in ultrasound think they're just going to scan babies, but Lynn has been in school for this long and hasn't learned yet about babies. So it's really cool to know that there's so many different things you can scan with ultrasound. And we're going to dive deep into the types of ultrasound scans there are. There's a lot. We do ultrasound on basically head to toe, everything. And yes, there's different specialties. And yes, there's different types of ultrasounds, and it gets confusing. And so today we're just going to talk about all the different types of things you can do.
Yeah, and we're just, like Giselle said, we're just getting deeper into each specialties and each type of studies or scans that we do. This episode is not just for the sonography community. It can be for anyone, because it could be used for what you can expect when you have, your doctor ordered an ultrasound, and then we would break down into specialties and what the types of scans, what it is, why we do it, right? Is that yes?
Yeah, because for the next few weeks, we're going to be kind of breaking down each type of scan, each type of specialty, but also more specifics, more stuff that you wouldn't really be able to figure out on the internet when you're just Googling, the ultrasound itself. Because when you do, you just find a general sense of what ultrasound is. They don't tell you the more specifics, why we do them, things like that. So we're going to talk about those kinds of things.
So let's get started.
Okay. So, we want to start off with general, though. There are different types they're in categories. So there's general sonography, echo sonography, and vascular sonography. Now, it's funny to say the word general because I want to talk about everything in general. I'm saying in general, generally, everything in general. But general sonography is different from echo, from vascular. So we're just going to talk about all the different ultrasound scans, and we are going to start with babies because that's what people think of us as and look at us as people who scan the babies. And by babies, I mean pregnant women. We have OBGYN, which is the most common scan that people think about ultrasound. And in OB, that's basically obstetrics. So it's anything and everything about the baby inside of a pregnant woman. And there's first trimester, there's second trimester, and third trimester scans. They're actually split up in different trimesters. And a lot of times people think that you can see a baby the minute you're pregnant, and you actually can't. You can only really see the baby on ultrasound maybe after 6 weeks. And that's just maybe if you catch it at the right time. But Lynn is still learning a lot about OB right now. And a lot of times we'll have patients come in and they're like, "Oh, I'm pregnant. Can you see anything?" And a lot of times you can't see anything because they're still too early. So that's the first trimester scan. Second and third trimester scan is usually after 12 weeks. And after 12 weeks, You'll do like anatomy scans or like later on in the later parts of second and third trimester, just to check all of the anatomy of the baby. And those are usually done in an OB office because hospitals don't do anatomy scans. Usually hospitals are limited. But in general, OB is like a major part of sonography, but also not the only part of sonography. What have you been learning about OB so far? Like,
So far, you just talked about OB, but there's the
mhm,
what OBGYN. So we've been
yeah.
learning about the GYN part of it. So gynecology. We're just doing learning about the routine gynecology protocol. So
Hmm.
pelvis.
Yep.
Just learning about normal anatomy of the uterus, ovaries, pathologies of the fallopian tubes, just anything in the female pelvis.
Yep.
And so that's another side of OBGYN where
Hmm.
there's no pregnancy involved. It's just pathologies and abnormalities in the female pelvis. So
Yeah.
I thought that was just like really cool. I'm actually learning to love it because it's
Mhm.
just very, very interesting. It's a lot of information. And I mean, eventually I want to do fetal echo. So eventually we can talk about fetal echo protocols and all of that and pediatrics, or
Yeah.
maybe you can talk pediatric echo. I'm not sure,
Yeah.
but we can touch upon it later
Yeah.
once I'm
Yep.
working. But yeah, I mean, I like it. I love it. I like
Yeah.
learning about it.
Yeah, so Lynn is definitely learning because if you guys have been following our journey, Lynn is actually a cardiac student. So she does cardiac and vascular, but they're also teaching her in her program OBGYN, abdomen, everything else as well. So, there is a lot to ultrasound, not just babies, but OBGYN, so OB being the baby's part and GYN being the pelvis part, it's one whole type of category. So OBGYN is a category that we will scan anything in the female pelvis, any pathology with the ovaries. So people who get, pain in their pelvic region, vaginal bleeding. We'll do transabdominal, which is on top of the belly scans. And then we also do transvaginal scans, which are internally, and those give you better imaging. But those are a very big part of the general sonography program. So if you're going into ultrasound and you want to go into just babies, because people ask me this question all the time, they're like, I just want to do OB. Like, where do I go? How do I do it? You have to work in general and you have to work in general sonography because you have to learn all of it first. Abdomen, you have to learn OBGYN and musculoskeletal all together before you can just specialize and work only in an OB office. So that's part of the types of ultrasounds that we do. It's very common in the hospital and the outpatient setting. Lots of OB offices, lots of hospitals, lots of doctors' offices. You'll be doing OBGYN in there. But another big part of ultrasound is abdomen. So are you learning abdomen too?
Yes, I am.
Yeah. And how has that been so far?
So far, it's been a quick review because
Mhm.
abdomen I find is really similar to vascular. What they come hand in hand, and now I'm just learning more what abdomen is about. And to be honest, I'm not really feeling it. Like I know it's very interesting, and I like learning about it, but I think for scanning, it's just I've been having a hard time scanning with like patients and stuff. I don't think it's for me because like the bowel gas, oh my goodness.
Yeah.
It's and like I'm a small person, I think, and most of the patients I've had are very heavy and or if anyone have like uh indications to do an abdominal scan, most likely I can't really do them because I'm so tiny and they're so
Mhm. Yeah, no, it's definitely hard,
it's
and
tough.
people don't realize that we do scan abdomen. So, there are pros and cons. Like we said, if you haven't checked out our pros and cons episode, we just did one last week. But it's really hard to do abdomen because it's a lot of things inside your abdomen. So people, when they realize we're scanning for their gallbladder, kidneys, liver, spleen, your aorta, and your IVC, as well as your pancreas, and just your general abdominal cavity. We have to know all these things. We have to know all the pathology for every single organ inside that abdominal cavity. So think about all the things that we know as sonographers to do abdomen scans. We'll get that question all the time. Is there a baby in there? But your pelvis is the lower part of your body where the baby would be. And then the rest of the body, obviously in the abdomen, those are all your organs. And we're checking to see like masses, cancer, if there's any stones, if there's any fluid buildup, if there's any abnormalities with your liver, cirrhosis, if there's portal hypertension, a lot of different things that we search with the abdomen exams. And we definitely, mostly, I think the most common reason why we do an abdominal scan is for pain. And they're checking like for any type of sort of something to tell the doctors like what's going on, why is there pain? And a majority of the time it's either like gallstones or kidney stones. But that's something that we do that people don't realize we can do. They're like, oh, you scan my abdomen and not just babies. So yeah, that's also part of it. And it's very important to know that, especially if you want to do anything else in the general sonography field, because if you want to do, let's say, pediatrics, you have to know everything in the adult first before you can move on to learning everything in kids. And just doing OBGYN, you have to do everything that you know in a human being in a little fetus. So if the way you have to understand is to do OBGYN, you have to know ultrasound of the human body, because all of that, everything from the brain, to the toes, you're doing that on a fetus in OB. So you're doing that on the baby. And so how do you learn all that stuff? Well, you learn everything about the human body first, and then you incorporate that with OB/GYN. Most programs they teach you abdomen first, and then later on you start to scan like pregnancies, because you have to know the anatomy first. Because like if you find cysts on a kidney on a adult, you have to be able to find cysts on a baby in utero, in the fetus. And it's so much detail. And it's like, how could you know that there's a cyst on the kidneys in a baby in a pregnancy if you didn't know what cysts on a kidneys in an adult look like? Those are things that you learn with abdomen and also musculoskeletal. We do, scans on breast, we do scans on skin, just random lumps and bumps. Testicles will scan for pain, swelling, trauma to the area. And then thyroid, we scan the thyroid for abnormal labs. We scan, the face, and we scan the face for like swelling, for all the glands in our face, in our neck, submandibular, parotid. There's so many different things we can scan. It's actually really crazy that you can really scan anything in the body. I'm saying like the whole entire body. And what Lynn does most for her studies are the heart and vascular, because she does echo and vascular. And so I'm going to let her talk a little bit about the types of scans for echo and vascular.
Wait, before I start echo and vascular, I wanted to add something about abdomen. So for abdomen, like my school had a phantom, which is like a mannequin that students can practice on of a prostate,
Oh, okay.
right? So do you scan prostates too, or that you know of, or like
So
trans
transrectal.
rectal?
Yeah.
Oh,
So out
and for
here,
OB and GN, there's also trans or endovaginal or transvaginal
mhm,
ultrasounds.
yeah. So I mentioned the transvaginal for like a split second when
Hmm.
we were talking about it, the internal better images. But that same probe we can use for prostates, which is transrectal.
Mm, okay.
And we typically out here, we don't do that in our hospital. They can order it, but the doctors usually do that in different settings. So I actually only do prostate with a full bladder, with like a bladder scan. So you can see the prostate right underneath the bladder for males, and you just do it that way. But in my hospital, we don't do transrectal because we don't do those. Um, Well, when I worked at an outpatient place, the doctors were the one that did that. The radiologists actually were the ones who inserted the probe transrectally for the patient, and we just helped them with the imaging. So we like pushed the buttons for the radiologist.
Awesome.
Yeah, I don't know if they make you guys do the transrectal out there.
Oh goodness, no. I can't speak for the other track,
Hmm.
but it's just based on what I've learned. Like there are these exams. It's just I don't know what
How they are.
places would
Yeah.
perform them or who would perform them.
Hmm. Yeah, because it's actually crazy. Every place is different. Like Lynn is in New York, I'm in Vegas, and every city and every hospital, every outpatient, every place has a different protocol. And that's why this field is so crazy because it's just different everywhere. You can't just say, oh, well, it's like this, so shouldn't it be this way, but it's not like that. You have to be very open to change, very open to different things. Um, Her protocol for her veins is probably different from my protocol for my veins. Same thing with her arteries, her arterial scans, and her ABIs, probably different protocols than mine. And so, there are so many different types of exams. And we just want you guys to know that there are a lot of scans, and it's not just babies. And it's very interesting. Oh, well, when you brought that up, also, we do procedures. I
Hmm.
forget to in general, we do procedures. We do like paracentesis and thoracentesis, which is to remove fluid from the belly and to remove fluid from the chest. We also do biopsies. So we take samples of tissue from people's either organs or like the thyroid. We help with liver biopsies, kidney biopsies, and there are also different OBGYN procedures as well. So there's so many different types of scans you guys are able to do in this field.
And I feel like as time goes on, there will be even more procedures when research and technology,
Mhm.
allows us to do.
Yeah,
So maybe we'll update more in a couple of years of what
I
procedures
know.
there are.
Yeah, because there's so many different things that you can do with ultrasound. I mean, I've actually had to bring the ultrasound machine into CAT scan once because they were doing
Oh,
some kind of something like I don't know if it was like liver or kidney, but I had to bring the machine into the CAT scan room, and then the patient was on the CAT scan table, and then we also had to scan them too. And then same with like going to the OR. We bring our machine to the OR, they're in the middle of a procedure, they want to use our machine, and we help them, because we're really good at what we do. So we help them try to locate what they need, like if they need the liver, if they need the uterus, if they're trying to do a DNC, which is a procedure that they do after a patient is like having a miscarriage or something like that. And we have to help them localize stuff. So ultrasound's really great for figuring out where something is in live time, in real, like where when someone's breathing, like you can see them breathing on the ultrasound. If someone's moving, coughing, swallowing, everything, talking, it's all captured on the machine. It's actually really cool.
it is really cool. Which
Mhm.
brings me to
Yeah.
Ecovascular,
Yes.
because you can definitely see the
Mhm.
heart pumping in echo as
Mhm.
you just put the probe on the chest and you can see the heart pumps and the valves open and close. And if you Doppler, you can definitely hear it flowing, the blood
Yeah.
flowing. Not so let's talk about echo.
Yeah, let's talk about echo.
From what I've learned, this is my personal experience, what I've seen, what I've learned. I am not yet a cardiac sonographer, so I can't speak more in depth to it, and I can definitely will in a year or so. So the protocols, there's routine protocols. So if most of patients go to their cardiologist for chest pain, so that's like an indication for you to be referred to a cardiologist or to be ordered an echocardiogram or abnormal EKG. Um, so the normal protocol for echoes is like they evaluate how your heart function,
Mhm.
and basically is the main one of the main things they look for is how much blood is being pumped from the heart to the rest of your body, and if your heart is functioning efficiently or not. So that's the goal of the echo protocol. And then there is stress echo, which is to see how your heart functions under stress. And there are three types of stress echo that I've learned. There's exercise stress echo. So they scan your heart at a resting rate, and then you run on a treadmill until you're too, like your maximum, or when you're too tired and you want to stop. Then they rescan your heart again, and then compare the images of when your heart is at rest and when your heart is after it's been induced with exercise. And there's nuclear exercise tests. So that's where they inject a radioactive dye, and they can just see how the tissues in I wouldn't say muscles, the heart muscles are functioning. And then there's a stress echocardiogram. I think it's very similar to exercise, but it's basically when you're on what's that? A bicycle. A
Treadmill.
bicycle. And they're scanning you as you're on your bicycle. So it's just like to see how your heart is progressing. So the goal of the purpose of a stress echo is to rule out coronary artery disease, and they can see like which arteries could be blocked, because if it's blocked, then your heart is not moving because those muscles aren't getting the oxygen it needs and it's not contracting. So they can see that. So that's the general overall. I mean, there are other kind of like substances, drugs that like dobutamine, I know Definity, they do. It's just, that's a general aspect of it. We'll talk more about it when we reach echo in a couple of weeks for another episode. But that's a gist of echocardiogram.
Wow. See, there's a lot you could talk about echo.
Yeah, the heart is so complicated, and lots of people think the heart is boring because you're just imaging one organ, but the heart does a lot to your body, and you can learn so much from that one tiny organ because it's just a very complicated organ and it does a lot to your body.
It keeps us human and alive. So
Yeah,
I think
definitely.
it's a very strong muscle, and it's very important. And I think cardiologists and cardiac sonographers are very important to this world. So the people who do these exams, like, they're very, very smart people, and they're very very attention to detail, because it's a lot of different things you have to look at.
Yes.
Yeah.
And like the heart, it amazes me every single time I look at it. I'm like, patience is 92 years old. It's like, how has it been pumping for over 92 years?
Yeah.
Because like these muscles, they're just pumping for over 92 years. And what your heart develops at what week? I want to say eight.
It's
right?
very early.
Like
It's
way
very early,
before you,
like 5 or 6 weeks.
5 or 6. So once that muscle starts pumping, it
Mhm.
pumps until you die. And I'm like,
Yeah.
how
Yep.
how is it possible? Like, how
Crazy.
does it last? That's
Yeah.
what fascinates me
Fascinating.
about the
Mhm.
heart.
Yeah. And
Like sometimes I could look at a person, I'm like, the heart is pumping and it's been pumping for that long.
you're like, wow, it's really fascinating. But yeah, this episode is really just to tell you guys in general, and it's introducing you guys to the types of scans we do, because we're gonna have future episodes where we dive into general sonography by itself, ecovascular by itself, and OBGYN and MFM by itself. So those episodes are going to be centered towards specifically that subject. But these are all the scans that you can do. And we want people to know that echo and vascular is actually a huge part of sonography, and not just OBGYN, because ecovascular sonographers, they get paid really well. They have a lot of job opportunities. There's a lot of vascular labs, a lot of cardiac departments that need ecovascular sonographies.
We haven't gone through vasculars yet.
I know.
Do you want to mention some studies?
You can talk about them because you like vascular. So
I do. Okay, so like I was like really into the heart
Hmm.
and it got sidetracked. I'll save that enthusiasm and that
For
passion
the
for
echo
the echo
episode.
episode.
Hmm.
So what the heart pumps blood through arteries and
Hmm.
right, and then
Yep.
the blood comes back through veins. So that's
Yep.
your vascular system. And then to evaluate why we scan vascular system is to see if there's blockage in the arteries. So that's a stenosis or like a lot or a plaque in the arteries, or blockage in the veins, which is a thrombus.
Hmm.
Am I saying this correctly?
Yeah.
Okay. All right.
You're learning.
So, so the exams basically anywhere there's arteries and veins, you can put the probe on the body and you can see. So that means brains all the way down to the neck. So the brain, what? TCD, Transcranial Doppler.
Hmm.
Um, you said that it's mostly done on babies, right?
It's mostly done on like kids with like sickle cell anemia or
Mm-hmm.
adults with subarachnoid hemorrhage, so bleeding
Yes.
in their brain. We're checking for blood pressure and pressure in the brain.
Yes.
Hmm.
Um, from what I've heard, a lot of sonographers, vascular technologists in or here in New York, most of them do to see or to rule out brain death or
Hmm.
confirm brain
Yep,
death, which is really
confirming.
depressing.
It is. It is.
Um,
But they
the
want to see
depressing part of
if because you know,
if there's flow, if
yeah, if
there's
there's
blood
flow
flow in
there.
the brain.
Because
So
if
that's
there's not,
TCD.
hmm,
Yeah, so that's
yeah.
TCD, and then you go down here. That's the carotids.
Hmm.
So that's the big
For people
arteries in the neck.
in your neck.
For
Mhm. I was
yep.
like, for
So
people
if
who
you
aren't watching the video,
experience, I
she's pointing
know,
at her neck.
I know, I'm just like touching my body right now. So if you're experiencing dizziness, that's a very good
Yep.
indication to get ultrasound in your neck, or blurred
Fainting,
vision.
stroke.
Yes. And then goes down upper extremities. So it's your arms
Yep.
and arteries in your arms. If feel any tingling anywhere that blood is
Numbness.
not flowing, or
Hmm.
you feel any symptoms, that's what vascular ultrasound is. So your arms, you can do fingers too, like to the tip of your fingers.
Hmm.
That's how sensitive ultrasound can be. And then we go down we all talk about abdomen. uh,
Abdomen vasculature.
yes,
So,
abdomen
but
vasculature.
that's usually done in general, but there
Yes.
is the aorta IVC
Yes.
echo.
So in vascular labs,
Hmm.
for abdomen vasculature, there's aorta, so triple A's, which is abdominal aorta aneurysm.
Hmm.
There's renals.
Hmm.
And from the cases that I've seen for renals in vascular lab is mostly due to patient with severe hypertension.
Yes, hypertension. That's the number one reason why you do a renal artery stenosis.
Yes, renal artery
Hmm.
stenosis, or FMDs, that's fibromuscular dysplasia. Am I missing any vascular abdominal
SMA
vasculature?
and CA, so the superior mesenteric artery and the celiac axis, where you're looking for any stenosis pre and postprandial, so before and after you eat.
Okay.
Um, that's part of the aorta, but
It is, but it's
that's a
also
mesenteric Doppler,
mhm.
just like a liver Doppler, because you did kidney Doppler. So there's literally you can
Yeah,
scan
you can
any
Doppler
vessel in the
anywhere.
body, and then you have the iliacs, right,
Hmm.
going down to the
Going
legs.
down to the iliacs, and then you got the lower extremities, which are your legs.
Yep.
So,
Look
and
at
then
that.
segmental pressure. So
Yeah.
besides seeing if there's a stenosis or blockage in the arteries and veins, we also test for blood pressure in the legs.
Hmm.
Right? So like for patients who experience like occasional pain when they're walking, which is called occasion, that's what segmental pressure is for. It's called,
Yeah.
or ABIs.
Hmm. Yep. And so Lynn just basically explained the whole entire vascular system
Yeah,
to you guys
I know.
from the head to toes.
That's because that's how I think. That's how I can
Yeah.
remember.
But yeah, that's exactly what it is. And that's the reason why we're, talking about this. Literally, there's so many things you can scan head to toe, brain, body's organs, and then you have to learn all that and then know it so that you can scan it in a little fetus and a little baby. So like obviously a human heart um, needs to be seen on a little fetus heart. And that's what she was talking about was fetal echo. There's different stages of life. There's fetal sonography, so like baby in utero. There's pediatric sonography after the baby is born, so neonatal, which is right after the baby is born. Pediatric sonography, which is when they're a child to teenager years, and then you have adult sonography. So we're really scanning everything literally from birth to, like she said, 92-year-old heart. Yeah. So it's actually wild the things you can do with ultrasound. And this episode was just really to tell you guys that there's so much you can do, so much you can scan the whole entire body, and it's not just babies. And hopefully this gets you excited for our future episodes. That's going to be more in depth with each type of specialty. And just because you want to go into abdomen doesn't mean you're only going to scan abdomen, or just because you want to go into OB doesn't mean you're just going to scan OB. Just because you go into echo doesn't mean you're only going to scan echo. There's so many opportunities where you can learn everything and cross train and scan and see everything. So yeah, hopefully this gives you guys an insight to the field of ultrasound.
So earlier in this episode, we talked about we are diving deeper into specialties scans that we're doing from episode 2. But I just realized that what we just talked about is those superficial. So we're going to be diving deeper into each specialties in the next week.
Yeah. Yep, we are. Because there's we just literally just gave you a gist of what we scanned, but there's so much more detail to every single thing. I mean, we're basically going over what you go to school for 2 to 4 years, and we can't talk about it all in 30 minutes. So,
exactly.
But yeah, hopefully this gives you guys an insight to ultrasound, and hopefully you guys want to stick around for more episodes about each type of exam.
Yes, and if you don't know anything about ultrasound or sonography, hopefully this episode gives you a gist of what to expect if you ever have an ultrasound exam.
Mm-hmm. Yep. And just know that there's a reason for why we do ultrasounds. We don't just do them just to do them. There has to be a reason and an indication why we do an ultrasound. And so if a doctor is ordering an ultrasound for you, it's because there's something that they're trying to figure out. You can't just do an ultrasound just to do it, unfortunately.
Yes.
You have to have a reason, and it can't be just just because I want to see it. There has to be an indication to do the ultrasound. But yeah, hopefully you guys stick around, and we'll see you guys in the next episode.
Yes, thank you so much for tuning in.
Thank you. Bye.